So, ladies and gentlemen, would you give a warm welcome? Woo! For our Secretary of State for Health, Matt Hancock. Matt.
I hope that means that the technology...
Oh. Try the sound again, guys. Try again, Matt.
I hope that cheer means the technology is working. Can you hear me? It's amazing how you can have conversations over video feeds these days. And I'm really sorry that I can't be with you in person, but Parliament is still voting now on the Queen's speech, and so I've got to be here to be able to vote. And so the wonders of modern technology means that we can be together. And if this call cuts out, I can tell you it's probably due to the patchy Wi-Fi here in Westminster rather than failure with the technology. Westminster, after all, isn't the most dynamic, fast-moving place. But I'm delighted to have the opportunity to speak today, because even amid everything that's going on here, there are something more important than Brexit. Things like the NHS, and in particular, primary care. And you've heard me say before, primary care is, in my view, the foundation of health service, the bedrock. And GPs are the bedrock of the NHS. And I'd like to talk briefly about three things that I think are fundamental to getting that foundation right and what we need to do, and then I hope we can have a Q&A. Number one, people. Number two, structure. And number three, technology. And if I take each in turn. First, people. There are over 3 times as many doctors working in hospitals than there are doctors in general practice in the NHS. And over a generation, the number of doctors in hospitals has increased at a much faster rate than the number of doctors in general practice. Yet last year, there were nearly 15 times as many GP visits as there were hospital admissions. Now, clearly, there's a difference in acuity in your typical visit to a GP. But there's also a disconnect with those figures and that direction of travel over a generation. And I think we need to put that right. The number of hospital doctors going up faster than GPs has understandable reasons. But if we're going to get the prevention agenda right, and we're going to help people to stay healthy in the first place, and if we're going to reduce the pressure on GPs, we've got to turn it around. I'm delighted that more than 1 million appointments a day now happen in general practice, but historically, we just haven't prioritised general practice enough. It's absolutely vital we get more people into general practice, recruit more, retain more, and make the perception and reality of being a GP as prestigious as any specialism. So there's some things that we're doing already. I'm delighted that the latest Health Education England figures for GP recruitment published this week show that 3,530 doctors have accepted a place on GP specialty training this year. That is the highest number ever in history. It builds on the record numbers we saw last year, and the 250 more full-time equivalent doctors we're working in general practice this year is good news, but we need to go further and faster. I am committed to delivering on the 5,000 more GPs commitment that is in the long-term plan. And we've already started very effectively to recruit an additional 20,000 clinical staff to support GPs in primary care within the next 5 years. And that recruitment is going well. Of course, all this needs to be backed up with money, and there's more money going into primary and community care. The 4.5 billion extra a year by 23-24, funding increasing faster for primary care than for the NHS as a whole for the first time in a generation. So I'm willing to put my money where my mouth is, or more accurately, taxpayers' money, NHS money, where my mouth is, and deliver on those commitments. Now, we know there are staffing challenges, and it's critical we address those challenges because this is at the root of having a sustainable NHS. So we've got to do a lot more. We've got to build on the recruitment success so far. We've got to address underlying issues that affect retention, workload, pensions, pay, training. And the the pressures of work that I hear about every time I go to a GP practice. Doing everything we can to help experienced GPs stay on or come back into the profession. So we've got to act both in terms of numbers and in terms of the mix of the workforce. But this isn't the only thing that we need to do. The second thing I want to talk about is structure. I like to use this analogy. Previously, many GPs were like soloists, or more recently, perhaps like a string quartet. Brilliant musicians in small groups. But now and increasingly in the future, you're going to be more like the conductor of an orchestra, pulling together a team of specialists to produce something more than the sum of its parts. So your specialist skill is always going to be vital to the delivery of primary care, but you're also going to need another set of skills as primary care networks and multidisciplinary teams expand, because it's about expanding clinical skills and leadership skills, about leading groups of people. Now, of course, many, many people do this already, and I've seen some brilliant examples. But across the board, we've got to ensure that leaders not only have the right numbers of people, but also the right structures in place to succeed. We launched the landmark clinical negligence scheme for general practice in April, and we're doing more to help to limit personal liabilities, to reduce risk, and to work in bigger teams. We want to make it easier for GP practices to become mutuals. We're bringing forward a range of recommendations in the partnership review to make people's lives easier. Structure also means addressing some of the outdated practice preventing GPs from being listed on the GMC's specialist register. It's not right, and it doesn't reflect the increasingly important role GPs are going to play in the delivery of personalised, preventative healthcare in the future. I want to work with the GMC to change this and include GPs on the specialist register at the earliest opportunity. But structure is also about process, and this is one of the things I've really learned in the year and a half that I've been doing this job. When I've seen practices and networks of similar sizes and similar demographics, there's a striking difference between the ones that perform really well and the ones who aren't performing as well. And the striking difference tends to be about the processes they have in place. By changing the processes, we can improve performance enormously. Now, of course, there are differences in the populations that different practices serve, and I get that. But you can take two similar practices serving similar populations and find vast differences in performance, and it's almost always down to process rather than clinical decisions. Let me give one example that I saw at the Corn Medical Centre, GP practice in Leicestershire. Their telephone triage system is excellent. Patients get a same-day telephone appointment, and if appropriate, they're then asked to come into the surgery, or they're directed to a pharmacist or other primary, or sometimes, of course, secondary care. And the reason it works so well is because they have one of their most experienced GPs on the telephone triage system. So they put their best people onto triage. So many surgeries instead use some of their most junior staff, often the receptionist, effectively to do a triage into an appointment. But an effective and efficient triage system makes an enormous difference to access. And that's what matters most to people, feeling like you can speak to your GP when you need it. And the interesting thing when I went to the Corn, and I've been to other practices who do things similarly, the interesting thing is the GPs say the best thing about this system is it means that we can go home every evening having done our job. And they felt that the pressure had come off because everybody gets the chance for a phone conversation, which often is much faster than a face-to-face, in-person consultation. And it's based on a 150-year-old technology that we're talking about, the telephone. It's so old, even Jacob Rees-Mogg's got one. So we're going to be informed by the Access Review. We'll enable the spread of best practice to support practices and networks. Many will receive targeted support to help them adopt new ways of working, to free up time, to improve access, and to implement best triage. This will build on the good work already done by the Time to Care programme. It's all going to be evidence-driven and evidence-led. That programme has already supported practices to free up more than 500,000 hours of time for patients. This brings me to the third and final thing that I want to talk about, which is appropriate given the way that we're having this discussion, which is about technology. I strongly believe that technology is our friend. It's allowing me to speak to you now. It's going to transform the way we deliver primary care. But it is emphatically not about replacing people. It's about enhancing what trained, skilled, experienced professionals can do. Let me try to paint a picture. You're a GP, you're also a parent. You're balancing work and childcare like so many people do, so many people in the room today. Using the technology of today, you could do video consultations from your own home after dropping the kids off at school. You can advise, prescribe, and book a patient with a colleague at your GP surgery or elsewhere in the primary care network if that is necessary to have that face-to-face, because the physical treatment and the physical consultation is always going to be necessary. Tomorrow, it might be the other way round. You might be at the surgery, your colleague might be working from home. Modern technology allows for modern ways of working and living. It helps with recruitment and retention, and above all, it means we can improve access for patients. People get frustrated by the lack of access, not just by the lack of appointments. At the moment, the physical appointments are often the only way to get access. But as we expand the phone and video, there's so much more we can do to help you to do your jobs, to get the very best out of each one of our 44,570 GPs. We've also got to fix some of the backroom technology, so to speak, digitizing paper records, real-time and secure access to records for GPs and patients, IT infrastructure that actually works, interoperable systems as standard, electronic prescribing to complement the millions of people now accessing GP services digitally. Getting all this technology right so we can deliver better care for people. That's what we all want. I care about technology because I care about people. So I think that making progress on people, on structures and technology, these things are vital. But I just want to end by paying tribute to someone who's done so much to improve primary care, both for staff and for patients, Helen StokesLampard. Helen, you've done a wonderful job as chair, and I'd say I'm sorry to see you go. But I'm also absolutely thrilled that you're only going as far as the new National Academy for Social Prescribing, which we launched yesterday, where you'll be championing general practice and leading the way on social prescribing. You know, yesterday when we were launching the National Academy, someone said to me that if antibiotics were the big revolution in healthcare in the 20th century, then social prescribing and using both medicinal and behavioral solutions to help people get better is the big revolution of the 21st century. I don't know if that's true, but I do know that with Helen in the lead, we're going to make a very, very good shot at it, and you're going to do a brilliant job, as you have done at the Royal College. So a great thank you, Helen, for your fantastic contribution. I'd like to welcome Martin Marshall to this vital role. I look forward to working with you because, for me, general practice has always been and always will be the bedrock of the NHS. Thank you very much indeed.
Now, I'm hoping that by standing here, Matt will be able to see me, and I won't be able to, yeah, you know, we'll try and work this out. So, Matt, I'm hoping you can see me. Thank you so much for your very kind words. That was very generous and slightly unexpected, so thank you for that. And thank you for taking the time out at what I know is a pretty crazy time down in Westminster for you to speak to us. I just jotted down a few questions. Now, normally, we'd love to throw questions open to the audience, but that was a tech challenge too far for us today to let the audience question you directly. So I've just jotted down a few things here. But colleagues in the audience, if you have other questions you would like me to put to Secretary of State, there's my Ask the Chair-elect anything session later. Come and throw those questions in there, and I can then write to Matt subsequently. So, Secretary of State, your title is Secretary of State for Health and Social Care. Sorry, Matt.
You can always email.
Oh, I could email, I could text, we could WhatsApp, whatever. Bring it on. your title is Secretary of State for Health and Social Care. Now, I know in general practice that on a good day, the social care system and the secondary care system are working in harmony so that we can deliver a seamless care to our patients. How are things going on the social care side from your point of view?
Well, we've been able to progress to putting money in short term to keep the system going, to make sure local authority budgets are there and are rising. We put £1 billion in last month in the spending review, and we've also given councils the power to increase the social care precept, effectively an extra part of the council tax, to put another £500 million in. But I'm also, as you know, acutely aware that this short-term approach is not good enough. The Prime Minister's committed to resolving this. He committed on the steps of Downing Street. I've been working very closely with him. He's taking a really close interest in the details on it. We've made progress. I'm not able to give you a full update yet. It's one of the many reasons I want to get Brexit resolved, because this is the sort of thing I'd like the Prime Minister and I to be spending our time discussing, rather than the precise details of our future relationship with the European Union, important as that is. So it's another good reason to resolve Brexit, so we can get the focus back on to the other big things like social care.
Okay, I'm conscious your time is very tight, so I'm going to leap onto a couple more questions, Matt, if that's all right. And I know that somebody's going to give me a wave when we have to wrap up. So, a couple of quick things. Tech is our friend, and I would absolutely agree with you that technology can help us to be better clinicians, better diagnosticians, and help create time for us to spend with our patients. But right now, I'm still working on Windows 7 in my own practice. There is a serious... It's true. 17 minutes to log on to my surgery on a Monday morning, and if I get through morning surgery without it crashing... Yeah, sorry, Matt, it's so true. There is a big shift we need to do to get the baseline up. And we all know the great stuff that can happen. I mean, I want GP to GP record transfer to just happen. So many of the problems happen at the interfaces and when changes are going on. What can we do to speed things up?
Look, we've got to do all of those things. I know that partly because I'm a Babylon patient, in case any of you didn't already know, because of that, this whole debate got going when I became Health Secretary, all tied into the details of the impact of that on patient lists and what have you, which I entirely understand and we are resolving. But the biggest frustration for me is just the low grade of most technology. Now, primary care is actually better than many hospitals, which just shows how much more there is to travel in secondary care as well. So, of course, we've got to have budgets for it. We've got to have the upgrades. I think that one of the reasons that the demand comes from inside the system as well as from patients on this is because we use decent technology at home. We all use our phones, and we're able to do this sort of Skype call. And then you go into the office, 17 minutes to log on. It's totally outrageous. And Windows 7, I don't think
Can you remember that?
I don't think they even patch Windows 7 anymore. So there's a cybersecurity risk, right? So potentially. So we've got to solve it. We've got to make sure we have the investment, but also the rules for things like interoperability that you talk about. The Lloyd George notes, I mean, that's totally ridiculous that they still have to be held. So we are dragging all that into the 21st century. Again, I want this to be evidence-driven. And NHSX is there to listen to what the needs are and then to help make it happen. But I just wanted to reiterate how I see it as the tech is important because we care about the people, both our GPs and our patients. It's not important in and of itself.
Thanks, Matt. I mean, video consulting is an upgrade on the telephone, not a downgrade from face-to-face, and I think we all agree on that. But thank you so much for taking the time to speak to us today. It's been very warmly received by people in the room, which is not always the case for Secretary of State for Health speeches. So thank you so much. Have a good day. Have the best day you possibly can in Westminster, and we'll log out now. Bye-bye, Matt. Thank you.
Thank you.